This topic is osteoporosis. Let's start by breaking the word apart. Osteo means bone. Porosis means porous, or holes are being created in the bone, a porous bone. What we know about normal development of bone is that we are in a constant state of remodeling or resorption. We're always building stronger bones. What happens in osteoporosis is there becomes an imbalance or a breakdown in that process. We are resorbing or remodeling bone at a much faster rate than what we can produce with our osteocytes and our bone cells. Thus, it leads to porous bones. This now makes our bones much more fragile for fracture. Our most common areas where we will see osteoporosis develop is the wrist, the hip, and the vertebral column. These are all considered small bones. Risk factors for osteoporosis include an advanced age. This is most common for women over 60. One of the biggest factors that's associated with it is a low estrogen level, thus postmenopausal state. Men can develop osteoporosis, but this is less common and it is associated with a low testosterone level. We oftentimes will see people who develop osteoporosis have a thin or small stature. When we are smaller in stature, our bones do not want to develop as strong as someone who has a bigger, more muscular tone to them. Habits such as smoking and excessive alcohol intake trigger an inflammatory response within the body. This inflammatory response, in turn, releases mediators, such as cytokine. This creates an environment that inhibits bone growth and ultimately chips away at the existing bone. Another example of this type of inflammatory response would be seen in an existing chronic disease such as rheumatoid arthritis. Sedentary lifestyle can also contribute to the development of osteoporosis. Again, when you think about a client who doesn't move, doesn't exercise, the body is not accustomed to carrying that weight and therefore will not build muscle and bone growth. Secondary osteoporosis can also develop. These would be seen in things such as vitamin D deficiency, malabsorption. People who have undergone gastric bypass surgery, for example, they've lost that ability to absorb vitamin D from their gut, so they may have a nutritional deficit in vitamin D, leading to osteoporosis. A medication that can be used long-term, such as glucocorticoid, can also lead to immunosuppression, which then inhibits bone growth. Let's talk about how osteoporosis is diagnosed. Typically, there are no symptoms unless an injury has occurred. With women, it is recommended that a bone mass density scan be completed, also known as a DEXA scan. This gives us that baseline or understanding of what their bones look like at this time. It could show evidence of osteoporosis, and therefore that is the beginning of the diagnosis. If a client does not have a scan, the other way that osteoporosis is typically diagnosed is through a spontaneous fracture. This is known as a low-impact trauma fracture. This would include something as simple as rising out of a chair, sitting down into a chair, or getting up out of bed. This would be in common areas, again, of the wrist, the hip, or the vertebrae. This will happen spontaneously. There will be a sudden onset of pain in that fractured area, and this can be in multiple areas, especially when we're noting the vertebrae. One complication that can occur as a result of progressive osteoporosis is the deformity that starts to happen in the vertebrae. This is known as kyphosis. As you can see in our illustration, what normal vertebrae curvature looks like as compared to the development of a stooped over posture. This will also lead to a loss of height of the client and, of course, worsening back pain. This is also known as hunchback. Nursing interventions will include some pharmacological support. This includes things such as vitamin D supplements, calcium carbonate supplements, and of course the addition of bisphosphonates. When we incorporate into the diet foods such as dairy products, fish, almonds, and our green leafy vegetables are all rich in calcium and vitamin D. We encourage sun exposure because vitamin D is a natural source from the sun. But let's also be cautious in our teaching that we do need to wear adequate sunscreen. We want to encourage the smoking cessation and limiting alcohol intake, as again we discussed earlier, that those habits create that gross inflammatory response within the body that inhibits bone growth. We want to incorporate weight-bearing exercises, such as just simply taking a walk every day, incorporating small hand weights into their exercise every day. We want to include fall prevention in our education with our clients. This will include not only shoes that support the body and the arches, but also we want to incorporate home safety, things such as within the bathroom, handles, grab bars, to help with fall prevention. Other things that we could consider would be the throw rugs that are laying on the floors. Those can be slip and fall, or water on the floor. We also want to make sure that the client follows through on repeating bone density scans, as this will allow us to continue to watch the progression or slowing down of the disease process.